Let's talk about bite reconstruction. So once we go through the assessment, we get to a diagnosis, then we get the joint stable and the patient in a comfortable place. Then we have to create a stable landing place for the teeth to come together. If not, it's like walking around with one high heel shoe on one side and a flat shoe on the other. You can do it for a while, but you're kind of limping along and your gait's off. And if you do that, well, if you walked around with one high heel shoe and one flat shoe for 20 years, do you think it would affect your knees and your hips and the muscles? Absolutely. Let me show you this case here. This is a person that has a lot of degeneration in one of her joints. So one of the joints had an injury and it's a lot shorter. When that's a lot shorter, the jaw moves to that side. She has the midline of her face in the middle, but then the midline of the chin is off to the side. That's obvious here in the bite too here. So we have the teeth on this side, almost edge to edge, and the teeth on this side on the inside edge to edge. The whole jaw is shifted over. Well, when you chew like that for a long period of time, it breaks teeth. So she ended up losing a tooth because she's just hitting on that one tooth. Hit, slide. Nighttime grinding, perfect doesn't happen. If we can improve it 80%, if we can improve it 50%, that's a win. So I come in here into the lab and I design the bite. From here, so I can add very conservatively. I don't have to grind her teeth down. I know a lot of people do crowns on teeth, and that's a fine way to do it. I have chosen not to do crowns if I can help it. Sometimes we need to, but mostly I do real conservative work with composite fillings. So then I create a flat spot for that pointy part of the tooth to come into, or I create a warp the upper tooth by adding composite filling to it to make the point come into a flat spot. So then I have the teeth hitting evenly. That's leveling the playing field. That's making both the shoes at the same level so you don't have to limp along. It's pretty exciting doing real conservative work because, one, it saves the patient a lot of money. Two, I can do most of it without you getting numb, anesthetic, anything else. Three, it's adaptable and changeable. Sometimes there's a joint that's aggressively changing. And today it's stable. Something can happen. You could get arthritis kicking up again. I've had that on a few cases. 7 years, 8 years later, we have degeneration in the joint and the jaw starts moving in. Well, this is an adaptable situation. If it's in composite, I can change it, I can add, I can subtract. My method of choice is doing composite or adaptable additions to your teeth to make the situation more stable. Another situation that we can get into is when we need to add length to the front teeth. People who have had a lot of jaw pain, a lot of jaw problems, grind their teeth. When they grind their teeth, they grind them sideways or flatten them here and wear them funny. And I can add to the teeth. I can even add to the lower front teeth. Very conservative, not grinding them down into crowns. And so when we add to the lower teeth, it's remarkable how strong it is in composite. And they just don't break. Surprisingly, they don't break. My longest case that I have out there is about 19 years. It's wearing out. I used Luxatemp, which is a temporary material, which is a much weaker plastic than the composites that we have today. 19 years is a long time. 19 years is a long time for something to last that I was supposed to be temporary. One of my main philosophies about head pain, jaw pain, getting the bite stable is to be conservative. What I mean by that is when I sandblast a virgin tooth and I add composite to it, I've taken nothing away from the tooth. I just add to it. It's not grinding it down. It's not taking away enamel. It's reversible if we had to be. I could take that off and you could go back to the way you were. We don't have flat teeth. We grind them down, our soul grind them down, but when we rebuild them, we want points and grooves. We want to do real conservative, stable bite reconstruction.